Good evening. Thank you all so much for joining us tonight on the second part of our health and wellness panel series. My name is Stacy Shapiro, and I am the Youth Engagement Specialist at the SYEP team at UAU. And I'm very excited to have all of our participants, all our panelists here today. I know we started some great conversations last week on mental health and wellness, and I'm excited to continue the conversation tonight in regards to physical health and wellness and ways we can keep building our physical health in the upcoming winter months. So I'd like to give a chance for all of our panelists to introduce themselves first. And I'll start with Ms. Smithy.
Hello, I'm Dr. Jacob. I'm from the Department of Pediatrics at Staten University Hospital, Northwell Health.
Thank you for being here, Dr. Jacob. We can go next to Sheena.
Hi, I'm Dr. Singh, and I'm also one of the pediatricians working at Staten University Hospital North with Dr. Jacob.
Thank you for joining us tonight, Dr. Singh. And now I'd like to give Professor Heather Butts a chance to introduce herself.
Hi, my name is Heather Butts. I am a professor at Long Island University in Columbia. I run the LIU Honors College, and I run a nonprofit called Health for Youth.
Great, thank you all so much for joining us tonight. I'd like to sort of start off with a general question to all of you. We see this, of course, with social circumstances, current social circumstances, we've seen that physical health trends have changed for the year 2020. So I'd like to know your insights and your thoughts on how physical fitness trends are changing for 2020 and what the expected trends will be for 2021. And we can start off with Dr. Jacob.
What I've seen a lot in my practice is that there's a sharp change in mental health, and that's impacting what physical health is doing for our patients. People are less active just because their mental status isn't as healthy as it has been prior to social quarantine and isolation, and that seems to be impacting how they're physically presenting with illnesses.
Thank you for that insight. Dr. Sangan, do you have anything you'd like to add?
In addition, I do agree with what Dr. Jacob said, but I have noticed also just in general, like due to just the less chance of having interaction, like just of children in school, like getting to play with each other outside of school, that's just impacting their mental health as well. And like they just, now everything's being done at home, not just like online learning, which is through the computer, but just even just to entertain the children, they're watching TV, they're just staying at home instead of being able to go outside like before. So that's also taking an impact into their physical health as well.
Right, that is such a true point. Heather, Professor Butts, do you have anything you'd like to add?
Yeah, I mean, I want to agree with both of the speakers and, basically just add that, I think you really sort of can't discount the shift that's pretty seismic that has happened for young people to go from being around other young people, being around others, to be able to engage and interact, to a complete shift in that, to being indoors, being online, being on Zoom. And so it's been decently, catastrophic is the best word I can think of. And to the extent that we assume that, young people are resilient and they can sort of roll with things and bounce back, I think we do a disservice to how large the shift has been for them. I mean, I know a lot of adults that are lying in fetal positions even as we speak because they can't really sort of make that shift. And so to assume that a 10-year-old is going to be able to just sort of roll with it and hop on Zoom and be okay with that, I think does a big disservice to them.
Yes, thank you. That's such a true and stark point. I'd like to sort of go along those lines. And we know research shows that young people may not be as physically affected by the virus, but they definitely are experiencing the physical health distress. that comes with social distancing, with staying away from their family and loved ones. In your experience, Dr. Jacob, what do you think? How do you think COVID-19 is affecting the physical health of youth and young adults?
Well, with them not being in school, not seeing their friends, not having that social environment, they're losing out on playtime, which is affecting development, it's affecting their motor skills, their general growth, and their bone health is declining because they're just not getting as much physical activity. So we're seeing that. And I think alluding to what Dr. Bretz was saying, there's like a level of trauma with the children are not, so they don't understand necessarily what the pandemic is and why this is happening to them. So this is a disruption in their life, their scheduling, their routines that is harder for them to overcome and make physical accommodations to. That's just a difficult task for anybody to do, and especially a child.
Yes, and to your point, Dr. Butts, how do you think we should begin this conversation with kids? Because they do take a lot of like their sort of social contexts from adults. So how can we start sort of talking about this and like sort of giving them a little more context on the virus and exactly like what it is?
Muted myself. So I wouldn't interrupt Dr. Jacob. I think there has to be a level of honesty here that's not here. I mean, I was just in a meeting, yesterday, and a lot of the adults were talking about, oh, well, why don't people know this, and why don't people think that, and why don't people behave in this way? And I think that's, again, it's challenging to just make these pronouncements and statements that people should act certain ways and do certain things and be a certain way. I say this to my students all the time. It's COVID. It's a pandemic. I mean, there's not necessarily a right way you're supposed to act. I'm sure we'll get into this in a little while, but people that are recovering from COVID are exhibiting, some of them, not everybody, but some long-lasting effects. And it's not all physical. Some of it is mental. Some of it we think might be, recovering from the trauma of having a very serious disease. And so to the extent that we acknowledge that, and acknowledge that we're all going through something that's very challenging and difficult, but if we can pull together and essentially be sensitive to each other and kind to each other, we can get through it together, then that's what we need to do. But to sort of try and sort of brush things away or pretend they don't exist or not talk about them, I think it's extremely problematic. And children, young people, they see things. Young people I know, they see a lot. They see things I don't see. Like, oh, wow, I didn't notice that. So young people are extremely observant. So if we as adults think we're gonna, pull one over, wink, wink, we're probably not gonna be able to do that. In fact, I know we won't. So honesty and, just being open about conversation, I think, is a starting point, which we all need to do a better job on, I would say.
Thank you, Dr. Butts. I think that is such a true and great point. And I'd like to give Dr. Sangan a chance if you have anything else you would like to add, any other insights.
I think Dr. really comprehensively answered that question.
All right, great. Just want to give you a chance too.
Don't worry, the next questions I won't.
Fine. That's what we're here for.
Yeah, exactly. Help each other.
So I will start off by asking this next question to you, Dr. Sangan. So you did mention a lot about the mental health issues, the physical health issues that youth and kids are experiencing. So how can we address these issues? Can you talk a little more about, in your experience, what these issues are like in person with you and the kids that you see in your practice, in your time?
Yeah, so in the clinic, we definitely see a wide range of ages of patients, of children, and every single one of them have been affected by the pandemic, from the elementary school kid to the middle school kid to the high school kid. And one thing that I found is very helpful is to acknowledge that they're feeling uncomfortable with the pandemic and like they're not happy as they used to be, and to just let them know that you're not the only one, and that really helped them to understand, okay, there's other people that are going through this with me too. Sometimes someone else just needs to state that to them. on top of that, just really making sure to talk and discuss with the parent, how you can keep the child mental health in mind, even after school. So after the online schooling is done, just ask them, how did your day go? Just try to keep a routine going as much as you can. Sure, you may not be able to go to the park or go to your friend's house, but like maybe you can just do some activities at home, just something to look forward to that in a way you can keep your mental health going and also maybe incorporate some physical activity too. Maybe do a family yoga time, just do something to kind of keep a routine, something to look forward to at the end of a school day, for example.
I think that's a really excellent point, really excellent tip. So thank you for that. Dr. Jacob, do you have anything else you would like to add?
Yeah, to add to that, what Dr. Sain was saying, the importance of a routine, I think, is where we can like start implementing changes. Prior to the quarantine, prior to the pandemic, we had routines. Our children went through their morning, their schooling, whatever their schedule was. And now that we're in an isolation setting, we've shut down our routines and trying. I think early on we thought maybe we can kind of wait it out, but now that it's had long-term impacts on their mental and physical health, setting up a regular time to check in with them both for their mental health and their physical health, being recognizing that this is an important thing to address, that this is a change in their lifestyle, that it's not an indicator of any sort of failure. This is an acute stressor in their life, and it's okay to feel anxious, it's okay to feel depressed, it's okay to feel fatigued or to lose concentration or to not do as well at school or have loss of interest in their hobbies. This is normal in this setting, and just to regularly check in with them and see how we can address that, I think is important to start establishing a routine to fix them, build their confidence to address their own health.
Yeah, thank you, Dr. Jacob. I think that is something that resonates with all of us. I do think that in times of like stress or any type of sort of traumatic experiences, we naturally tend to sort of subdue our emotions and subdue our feelings in the way how we feel, what we think. And I think it's important to actually let us sort of talk things out, especially with our children. I'd like to give Dr. Butts a chance if there's anything else you'd like to say.
Oh, that was a very comprehensive answer. I mean, I think, I love the routine answer because, again, this is not my personality, but I know a lot of people, they get very set in a certain kind of routine, and then it's hard for them to get into a new routine. But the thing is, if you like routines, I do like routines actually. So if you are someone who likes routines, being able to find a new routine and then get into that routine, I think can be everything. So, especially like if you're, doing remote learning and you're teaching your child at home, you're working with teachers to teach your child at home, your old routine might have been, we walk to school every day, right? And so then you might be like, oh, I missed that so much, and I missed the walk to school and so forth. But maybe the new routine can be you get up in the morning and you do yoga together, or you do meditation together, or you do, we'll talk about it a little later, but we have a cool virtual soccer program that we do at Health for Youth. And we're always trying to get more young people involved. And we have drills online that students can do. And you can do, like a soccer drill in the morning with your children. So finding a new routine that you can do, I think is critical, especially in this time that is so unsettled, to create routines, even for people who are a little more easy breezy. Routines can really make a difference.
Thank you, Dr. Butts. I think that's such a great point. And like to your point, you did bring up changing routines. So I'd like to ask you a little more about that. I'm sure, like you mentioned, a lot of students have shifted from in-person learning, and now they went remote, and then recently they went back to school, but then went back to remote, and now with winter break happening, I know that's a lot of shift in routines. So could you talk a little bit more about that and the sort of like health effects that may come from having such drastic changes in your day-to-day routine?
It's totally haphazard. From a psychological perspective, it's very difficult, and can be traumatizing for children. I think that can't be underestimated. Children really do like to have stability. As much as some parents think that their children are going to be angry with them when they create stability and create rules, young people like it. And if they don't find it within the home, they will find it somewhere. That's why sometimes if a home life for a young person is very unsettled, they will find the place that will create those rules for them. And sometimes we don't like where they go with that, but they will find it. So to the extent that parents and guardians can create those new routines. And again, shifting so quickly from in-person life to the online life is challenging. Again, we have the soccer program that we do, and the soccer program was in person for a year, and then we shifted within a week to an online platform. And that was really difficult for a lot of our students to shift over. It's taken a while, and we haven't gotten everybody over to that. And I feel like that's we've got to do a better job with that. But to the extent that you can help people in terms of some of those transitions and creating that level of stability and acknowledging how traumatic it has been for everybody, even the most sort of introverted, I live in a cave in good times kind of a person who was maybe clapping at the beginning of COVID that they could just remove themselves from society. I think even they 9 months later are saying to themselves, wow, this is a bit much even for me. So I think even the most I'm super happy to be isolated person has had some effects from this, and so that needs to be acknowledged.
Yeah, thank you. And to your point, like there is sort of like this more emphasis on screen time, whether through like virtual programs like after school or enrichment programs, but then also through school and learning. So I'd like to give Dr. Jacob and also Dr. Sangan a chance to talk about what sort of physical health effects may come from this increased screen time. Maybe we can start with Dr. Sangan.
So starting from the main thing, looking at screens all day long, your eyes. Like for sure, like especially now, now that things are starting to open up a little bit, kind of, like definitely go get your eye checked, and that would be very important to do. And just from the physical fact of sitting all day in front of a computer in the same position. I know like during school hours, some online schools, what they're doing is normally in between period classes, you're able to walk between class to class, let's say for high school. But now what they're doing is in between classes, they're giving a break of like a few minutes just to get up, stretch, walk around, get a drink of water. And I think people should take more advantage of that. And that can be translated to like younger children as well. Like just to have like little sectioned timeout break that are scheduled into the daily learning course of the day. And that way we can just the physical act of just getting up, walking around and moving would be really good too, and always stay hydrated.
Yeah, thank you. I think those are some really excellent points and insights. And Dr. Jacob, do you have anything else you would like to add?
No, Dr. Thing had summarized really the problems that we're seeing with this increased screen time. The AAP recommends less than 2 hours because we see a decrease in physical activity when a child spends more time in front of the screen. So the changing in your vision can lead to headaches, can lead to muscle fatigue. You sitting in the same posture is hard on your neck, it's hard on your back. Not moving is not physically holding a book, not holding a crayon is not giving children the time to develop those fine motor skills. So we are seeing, there's a reason why we don't like screen time as pediatricians. We obviously, in a virtual educational world, we can't do very much about the fact that everything has to be done on screens, but finding those breaks in between classes, going for a walk, stretching, move and hydrate, and do as much as physical, like color something and then show that to on the screen so they can get physical touch exposure to a book or to a pencil, to scissors. That's important. And doing as little as you can on the screen. So now that we need to do our school, working from home and education on screens, there should not be a TV on during lunch or dinner time. Like that's time protected away from a screen time. The screen should be off right before sleep to try and promote sleep hygiene, because we can't do this extra screen time that we were doing previously because now our entire life has become screen time.
I just wanted to say I love Dr. Jacobs' point there, because there are 24 hours in a day and you're supposed to be sleeping, or at least 30 of those. If you're younger, a little bit more sleep. But if there were limitless hours in a day, then I guess, yeah, maybe you could be on, it wouldn't be good, but maybe we could say you could be on screen time for a bunch of time, and then you can go and play for 8 hours, and then you can go run and, but because there's a finite amount of time that we have, any time that is added on to your screen time is time that's taking away from time that would be good for you to be physically active, getting those motor skills where they need to be. So I love that point, because it's not so much that, a parent or a pediatrician is saying, we don't want you to be on your computer. I mean, they kind of are in a way, but they want you to be there, but there's only so much time. And so it's a really, really fabulous point that you make, because it takes away from the time that we would like for you to be engaging in other ways. And that's critical.
Yeah, I agree. I completely agree. I think it is important to sort of emphasize and not to understate like the physical health effects, the physical development effects that do occur because of this additional screen time. But I also like to like dig in a little more into the social emotional learning and like effects on the social emotional development that happen and that are sort of happening now because of this online learning. Like I know school isn't just for education, there's a lot of sort of engagement and activity, and you're like meeting other kids and engaging with them and making friends. And obviously now in this setting it's a little more difficult. So what are ways that kids can sort of try to get around that and still sort of maintain those friendships and build those social emotional skills? And I'd like to give Dr. Beltz a chance to start this time.
So that mute button. I'm gonna shamelessly plug, a couple of our programs, because that's what we're gonna do. But in my nonprofit is called Health for Youths, and we're 11 years old, and we do most of our work in Staten Island, although we're a citywide nonprofit, and we also do work in Philadelphia and New Jersey. We're a service provider for other organizations and nonprofits and community spaces. And so an organization will usually come to us and say, we need this, and we help them do it. The main programs that people kind of know us for on Staten Island is our Little Free Library program. So if you see a Little Free Library somewhere on Staten Island, we probably had something to do with it. There's a few we haven't, but we'll work with them. Yeah, we have Little Free Libraries all over Staten Island, and we've converted them into Little Free pantries. So now we're putting supplies, necessary canned goods. And I know, I'm sorry to the doctors here, we don't love it to be canned goods, but they're non-perishable. So we do what we got to do. Okay. But one of the reason why I mentioned Little Free Libraries is because we also have young people help us build them. So that develops a lot of skills in terms of your spatial skills, your hand-eye coordination, your ability to communicate, to get along with other young people. And we've had young people as young as 8 or 9 help us build these Little Free Libraries. Now in COVID times, obviously because of social distancing, we have not been doing the building of the Little Free Libraries, but we've been doing other things that are helping to maintain them, that people can do socially distanced. And we have young people that volunteer with us all the time. So that we're still doing gardening projects during COVID, socially distant. We're doing trash cleanup throughout Staten Island and beautification projects. And again, we actually can do all of this in a very safe, socially distant manner. With the last project I'll mention is, I've said it before, our virtual soccer program, which is on Saturday evenings. And we have students doing drills virtually with us. And that a companion that is a Robo Soccer program that we have on Sunday mornings, which anybody's willing is able to participate in. And we're working with students to build robots and then code the robots. So I think that's pretty good in terms of motor skills. And we're in week 13, and we're actually resetting this Sunday. So if anybody were interested in joining us Sundays at 11 o'clock, we're going to start our new robots, building them for the next 10 weeks, and then actually coding them. And so we have to be on Zoom to give the instruction, but most of the time it's the students looking away from their screen and actually building the robots in real time. And it's fabulous. So that's some of the programming that we do. And, we welcome anybody to be a part of it. It's all free. So, we don't charge anything. We charge a smile and the happiness that you're there. So.
That's all very wonderful. Thank you for sharing those resources. I think it is important to find ways to get around sort of the social distancing guidelines and still find ways to both help and improve the development of children and then also improve the development of adults, because we always are still developing and we're still changing, we're still growing. So we have a question from Facebook and from the audience about tips for adults as well, in ways that they can sort of considerations for screen time and anxiety. And if you could speak a little bit about that, I'd appreciate it. And to give Dr. Butts a little chance to catch your breath, I will give the floor first to Dr. Jacob.
The rule, in my opinion, of trying to limit as much screen time to what you need to do on the screen applies to adults too. How often do we cook with something playing in the background? How often do we just watch our show? And I understand that everyone needs their show to unwind, but trying to limit that to what we have to do on a screen and then trying to get out. There, Dr. Butts mentioned great options for ways you can stay active while staying socially distanced. This quarantine does not require you to sit in a chair all day. That's not the rule of the quarantine. If you're not having a fever, if you're not coughing, you're not symptomatic, go wear your masks, be away from people, but get outside and do something. And that's something that adults can do with their children to set an example for, look how we can wash our hands, put our mask on, stay away from the crowds, but still go for a walk, still go to the park, donate to pantries, volunteer. These are great things you can do. You don't need to sit on a chair all day.
Very well put. Thank you so much, Dr. Jacob. I'd like to give Dr. Sangan a chance. If you have anything you'd like to add, I know that answer is pretty comprehensive.
I think for adults, like older kids especially, that kind of spend more time on their screen, I think one thing to keep in mind is the screen light itself is the blue light. So if you're able to switch it to nighttime mode, to the orange light, that's less annoying on the eyes and it's less stimulating. And also if you know, okay, I'm gonna go to sleep around 9 p.m., 10 p.m., just 2 hours before, just consciously make a choice to turn all the screens off and just kind of settle out. And that's a really good time to start a bedtime routine too. You can do for adults, if you need to meditate, do yoga, do some painting, put some music on and dance in the little corner, just do that. If that's your way to kind of de-stress after a long day. And adults can do it, you can do it as a family too. And I think that's a really good way to kind of be very mindful and conscious of your screen time. And in this way, especially now, we need the screen. This is part of our daily routine. So you have to just find a way to adjust around it. And just like Dr. Butt said, great ideas of going outside and you can stay active. You can still go outside, just social distance, wear a mask, wash your hands. And there's things to do at home too. You can kind of decompress, in your family, you can do a little cooking activity, do dinner together, just have a recipe from a cookbook rather than from an online. So that's less screen time just from there. So just be mindful of ways that you can kind of take the screen out and add something else instead.
All right, thank you. And to that point about ways to sort of get away from the screen, limit your screen time, I know Dr. Butts already spoke a lot about some of the resources that are available at your organization. I also want to give a chance to both Dr. Jacob and Dr. Sangan to say if there's any resources or sorts of tips or guidelines that are available at SIHU in regards to helping improve physical health, helping sort of limit screen time.
I personally don't know anything that's coming out of Staten University Hospital. I just know the recommendations that we give to especially our older children in clinics. Gyms are not a ideal thing going inside where you're oftentimes uncomfortable. You're taking your mask off. You're often touching your face when you really shouldn't be. There are many outdoor settings that activities are doing, like gyms are doing outdoor classes. They're trying to go to a park and do their stretching, their yoga. People are doing their fitness outside in an open space, and that we oftentimes recommend. Schools are sending out invitations for there to not be a party. We're not doing any of that, but everyone go outside for this 30 minutes. You had recess in your school, so take your recess time, get some activity. This is all, as long as you build that into your routine, into your schedule, this should ways we could blend our quarantine life into our usual world.
Great, thank you. I know you already sort of answered in terms of sort of in regards to SIHU, but I want to know if Dr. Sanger might have any other insights or anything you'd like to add.
Same thing. I don't have any specific resource that I know about regarding like screen time and physical activity. Like we have our recommendations that we do give to the parents and to the kids as well. So similar to Dr. Jacob was saying. I mean, that's basically it.
And if someone like wanted to look up these resources, are they available online somewhere? Could you point us in the right direction if you do know?
So there are resources online, like even just on the AAP website. Let me see if I can find some, but like I can send a link forward too that we could put out. But just like even there's so many workout activities that's on YouTube, you can follow along. Once you get used to, okay, this is how you do this workout, you can translate that outside. You can just bring that outside and do it with yourself. You can do it with your family. And even there's even workout books and video like picture resources with the illustration. Like, sometimes in the gym they have a picture of like all the different workouts you can do based on this machine. Well, sometimes they have exercises that you can do without the machine. You can just look up those pictures and just have it printed out. That way you have it for your future reference. You could do it outside.
Yeah, I think that's such a great point. I know there are a lot of different exercises, like exercise videos out there that you can do using just something simple as like household items. You don't have to go out of your way to buy any sort of like equipment. So thank you for noting that. And if you do share that resource, we will of course make sure to post it on our Facebook and also on our YouTube and on our social media pages. And I'd like to give Dr. Butts a chance to speak a little more. If you have anything to say or any sort of resources that you recommend for both youth, young adults, and children to look into?
I mean, I actually just want to give a shout out to Staten Island University Hospital. They do a really great job in terms of their community outreach. We've done a lot of programming with them actually, and those who coordinate on youth activities. And they actually they're not a plug for SIUH, but if you go to both their website and their Facebook page, you'll actually find like good resources and good articles about some of what we're talking about. So yeah, they're excellent in the community in terms of reaching out and working with youth on a variety of areas. And every time in the pre-COVID days when I did, outreach efforts and fairs, they were always there. So it's a great organization and do great work.
Great, thank you for that insight. I kind of want to sort of shift focus a little bit. Like we've been talking predominantly about both children and young adults that are predominantly in high school, but I sort of also want to give a chance to talk about young adults who are in college because they do have a little more sort of control of their school schedules and their class schedules. And I know most, if not all, schools are starting their winter breaks by the end of this week. So I'd like to ask all of you to give a little insights onto ways that they can improve their physical health concerns that might be sort of particular to this age group, and ways that they can build their physical health during their break period, and then also ways they can sort of keep and maintain that when they go back to the semester. And I guess I would like to start off with Dr. Jacob.
So the young adult population is a great blend of children who are learning how to become adults. They have a lot more independence, a lot more autonomy. They can control their schedule in a way that younger children can't, which is actually very helpful because they can be, if they recognize their mental and physical health and how that is changing with the quarantine, they can address that easier. So when we go out to get groceries, instead of taking the bus, taking the subway, whichever way people commute now, going for that extra walk is a great way to just get some exercise in. Trying to organize you can control your schedule better. So when your job requires you to commute somewhere, move somewhere, you can do that as a physical activity. There's so much more autonomy that young adult age has, which is nice because they get to do a lot more with that.
Great, thank you. I think those are all wonderful points and very true. Dr. Sangan, do you have anything else you'd like to add?
So building on to what Dr. Jacobs said, so they have that independence and they're able to coordinate and like work with their friends. So even if they do something like, oh, okay, like they talk to their friend, they decide, okay, how about every Monday, Wednesday, Thursday, we count our steps and we just compare, see who wins or something like that. They can just play little games, and this way you're more motivated to be more physically active if you're able to work along with your friends. Even though you're not right next to each other, it's okay. You can still gather your friends and just kind of work out together and like make conscious choices. That's the main thing, making conscious choices.
Thank you. I think that is so true. Like you both mentioned, they do have a lot more autonomy in this age group, and that can sort of definitely lend itself to allowing them to have more time and more abilities to be physically active, maybe not spend so much time on their screens as their younger counterparts. Dr. Butts, do you have anything else you'd like to add on the topic?
No, I love those answers, and I think the focus on being intentional about what you do is key. So no, I don't have anything to add except I agree with both of the speakers.
Well, thank you for that. And I'd like to sort of again shift gears. Like we were talking a little bit about changing routines and like ways that you can sort of establish a new routine now. So what are sort of like self-care routines? I know you all mentioned a little bit before, like things such as yoga, meditation. So what are how can someone sort of get started on that? Like what resources can they look into? Like if there's someone who has never done yoga before, has never done or tried meditation before. So where do you recommend they go to either get like just learn a little bit more, figure out which sort of self-care routine works best for them? And I'd like to start with Dr. Sangan.
So I think the best way to approach that is to know what you like to do. If you're someone that already had a routine before, that's okay. You can keep the same routine, you just have to adjust it. Let's say for a little younger kid, like their routine before bedtime, for example, it could be like, okay, let's do a little walk around the house, but just walk around the first floor, and then brush our teeth, take a bath, and go to bed. Maybe older kid, you could incorporate a bit of a workout too. And getting into workout, it can be intimidating at first, but there's always a first time for everything. And especially now, there's so many resources online, and there's so many group chat, there's Facebook group, there's all kinds of resources and that you can go to. And even there's so many apps on the phone too. I know we're not trying to limit our screen time, but it's okay if we kind of let it guide us. They have so many beginner introduction courses to meditation, to yoga, to Pilates, even just to really come, like with a bath time routine. If you're someone who likes to do a little face mask before you go to bed, okay, then maybe you can do a little walk around the house, around the neighborhood, come back, have her put a face mask on and just listen to some relaxing music. And all during this time, you don't need your screen, you don't need your phone for that. You can have your music on in the background and then just let it kind of calm you down, de-stress. And that's a really good way to kind of figure out your routine. And I found for me personally, it's a little helpful to keep a little journal of like things that work and don't work for me. And listening to recommendations from other people. Someone may say, oh, you know what, this video is really good, you should try this out. Okay, I'll try it out. If I don't like it, that's okay. I tried it out and I know I don't like it. You just move on to something else. Once you find out something, try it out for a few days. If you stick with it, that's your routine.
Thank you, Dr. Sangan. And I'd like to move to Dr. Jacob, sort of to build off of your point and reiterate things that you said before. So what are ways that we can maintain physical activity while also sort of pertaining and abiding by social distancing guidelines?
So with young children, I always recommend, like very young children, I always recommend to re-engage them in play. They used to have playtime with their classmates, with their friends. We don't have that social interaction anymore. To teach them eye contact, to teach them reciprocal play, to make them engage in social interactions. Parents, families, their caregivers can play with them in whatever fantasy world they want to play with. That is a form of physical activity. Dance is a form of physical activity. Gardening is a form of physical activity. For older patients, young adults, and then even adults, I personally love walking meetings. So if I don't need a camera on during my billion Zoom meetings, I don't have my camera on and I'm walking around the neighborhood or my house or my apartment, or the case is, as little time in front of the TV perfectly. If I'm just audioing, there's no reason for me to be sitting. As much as you can be standing, it's just better for your back, it's better for your posture, it's better for your, it increases circulation, it decreases fatigue. Ways to kind of keep yourself stimulated will help with concentration, and then that in turn will play into your mental health as well.
Yeah, thank you, Dr. Jacob. That's such a great point. And I think it is important to maintain physical activity. And I think one of the best ways to do that is like when you get other people involved, like your friends, and more often or not your family. So Dr. Butts, I'd like to ask you sort of your recommendations on, I know we all talked about, you've all mentioned different ways that families can get involved and sort of be physically active together. So if you could reiterate some of your older points and sort of add on to with anything else you'd like to speak on.
Yeah, I mean, I spoke about, a bunch of resources. Another resource I just wanted to mention is something called headspace.com. I don't know if anybody's ever heard of it, but it's actually a super great website for meditation and mindfulness. The person that's the founder has a very soothing, like, British accent, and if you like soothing British accents, that's the place for you. And actually, they created a partnership with the governor's office in the state of New York to create something called headspace.com/NY. So if you go to that site, it's actually specific. It started when New York was at the height of COVID, but has continued on. And so if you go to that site, there's actually meditation and mindfulness and all sorts of sort of deep, restful exercises specifically for New Yorkers. So that's just a resource that I really like and I think is good for people. And then in terms of, getting together with family, a lot of what I said before in terms of routines and creating new ones and reimagining how your family relates to each other. I think these are all ways that people can be really creative. And I know, again, COVID is painful and awful and difficult, but there is an opportunity to kind of reimagine how you live your life and how you interact with those you care about, and maybe some ability to be even more appreciative of those that are important to you. So
I think those are all some very strong and true points and insights. Thank you for that, Dr. Butts. I'd like to sort of again switch gears a little bit to talk about something that was also mentioned in the chat, but I think something that also requires a lot of attention and importance. And that's one particular area of concern is at-risk youth. So that like children or youth with disabilities, youth that are foster involved or justice involved. So what special considerations need to go to this cohort, to this group of youth in terms of their sort of the physical health effects, I should say, that they may be experiencing due to the virus, due to social distancing guidelines that that might be sort of unique to this group, and what are some sort of guidelines or tips that you can provide on helping this youth and their family and loved ones. So I'd like to give Dr. Butts the chance to start off.
Yeah, I can talk about this all day, but I won't. I'll limit it to 30 seconds. Yeah, I mean, this is the
as long as you need.
No. This is the population of youth that, I mean, I guess maybe, I sort of buried the lead with that in Health for Youth. This is the population of students that we deal with every day. Young people who are, court involved, you know, or justice involved, whatever term you would like to use. Young people who have aged out of foster care. We deal with them a lot. You're 18, you've been in foster care most of your life. Now you're not anymore. What do you do? That's not such an easy question to answer. Young people who are homeless, who have been homeless, young people who are otherwise underserved, young people who have some sort of disabilities. So this is the population that we actually specifically focus on and cater to. And I mean, right, in normal times, a young person who's in foster care doesn't have the services they need. So what in the world is going on in COVID time? It's not great. So these are young people that we absolutely have to support and focus way more in terms of all of what, you know, our wonderful doctors on this panel have been talking about in terms of needs. You know, for somebody in foster care, it just gets ramped up because you already don't have the support. You already don't necessarily have consistent guardians who are there to make sure this is happening for you. So these are all young people we need to support. I know our nonprofit, we're doing more with respect to supporting these groups of young people, trying to get them more engaged. And if you're thinking about ways to help and be out there in the world, this is the population that needs it.
Great, thank you. And if you could talk on a little more about this type of support that your organization specifically provides.
Sure. I mean, we, you know, so we actually have a YouTube page that I was never into YouTube. I'm of a certain generation that all of this is a little bit ramping up for me. But now I guess I'm a YouTuber. I'm out there doing YouTube videos and I haven't gotten a TikTok yet, but YouTube, baby steps. We have a daily story time that we do on our YouTube. All of this is free. So, if you go, our YouTube page is youtube.com/health4youth. And if you go there, you can access all of our programming. So we have daily, we try to do them daily, story times. They're about 20 minutes long, and you can, read it with, your young person, if you're a foster care parent, or, if you're working with young people that are homeless. I talked about our virtual soccer, which we do tons of. So we have tons of programming virtually that we're getting out into the world. And then obviously we're also supporting these young people in ways that we can that are safe and socially distant with programming that we can provide for them, and, community outreach, gardening, clothing drives, we've done that. Food drives, we've done that. So these are always dropping off food. We do that all the time safely. So these are all ways that we've been helping these populations of young people who are way more underserved and unnoticed, unfortunately, than they should be. And so we are trying to change that so that their stories are heard, and that people can see them, which oftentimes people don't.
That's very true, and such a very historic point, Dr. Betts. I think what you said, of course, these are youth, these are communities, age groups that are typically already sort of forgotten by. And then, of course, now you add on to this pandemic, and that just adds a whole nother array of issues and factors that a lot of people unfortunately forget to consider. So thank you for keeping that top of mind. Thank you for talking on that. I'd also like to give both Dr. Sangan and Dr. Jacob a chance to talk about your insights, what you think are additional unique considerations or tips or guidelines that you can share on ways that we can further continue helping and supporting these youth. And I'd like to give Dr. Jacob the chance to go first.
I think it's very important what Dr. Butt says. This population generally has a higher risk of poor mental and physical health. They just don't have the resources available to them at baseline, and during a quarantine when the society is limiting resources as is, I think oftentimes that is unlooked. I do want to encourage, I encourage all my patients, and I specifically encourage high-risk populations to seek out the care they normally would, but via telehealth. Your doctor is always there for you. There's nobody is not seeing patients. We can do it via telehealth. If there is a concern for isolation, your counselor should see you, your therapist should see you. You should continue to take all the medications you need and refill them as needed. You should seek the care, physical care that you need, mental care that you need throughout this quarantine. Your health did not go on pause while we're doing an isolation. You need to continue caring for yourself and providing for yourself. And your support system that you had in place is available for you. It just is a different venue.
Yeah, that's such a great point. Thank you, Dr. Jacob. And sort of in connection with that point, Dr. Sanger, what sort of recommendations do you have for healthcare professionals and more on like the clinical perspective on ways that we can help support these more at risk, more at need youth, and then in general, also youth overall during this pandemic?
So just like Dr. Butts and Dr. Jacob said, like I'm not gonna copy what they said, but like there's another point that I realized too, in the hospital, we have a lot of the houses of worship, like church, synagogue, mosque. They are very willing to help, and they have so many resources as well, and they actually have more fingers into the community than some of the hospitals do directly, and that would be a really good way to kind of lead and make sure that the underserved population are able to get served, just from the sheer fact of a lot of them have resources in the community directly, but they may not feel comfortable to come so much to the doctors and to the therapist just for their physical and mental health, but this way you can reach out to them through the community, through the houses of worship as well.
Yeah, thank you so much for that wonderful point. It's very well taken. And again, I'd like to talk a little more about in general, like sort of on the clinical perspective, what are ways that healthcare professionals can help with social distancing guidelines, ways that they can themselves improve the physical and mental health of the people that they serve. And I'd like to give Dr. Jacob the floor first.
I personally am a big advocate of recognizing your mental health in this time. I think that is the biggest driver of fatigue, poor concentration, dropping grades, is that they're not addressing the fact that they've had a mental, emotional trauma during this quarantine. And that is giving them physical symptoms that are very real and very bothersome, and they can't figure out why. And it's, well, do you feel down? Do you feel anxious? Do you feel like your stomach is always in a knot? We need to address that. I think healthcare providers have recognized how important it is to kind of to check in regularly, whereas you may see a patient every 6 months. This is important to see them a little bit more frequently, even if it is just a phone call to say, what do you need? What can I provide for you? And are you okay? And if you need to come in to see somebody, then come in to see somebody.
Thank you. I think that is so true. Dr. Sangan, do you have anything else you'd like to add to Dr. Jacob's point?
Now, Dr. Jacob may have made a very good point, but we're very well connected with each other. Like we have resources in terms of, we know other pediatricians, we know therapists, we know psychologists. So if there's anyone that you need, just reach out to one of us. And even if we're not able to directly provide the service, we know someone that can help.
Yeah, that is so true. Thank you. Dr. Butts, do you have anything you would like to say?
Oh, wonderful. No, just that, you know, unfortunately, a lot of underserved young people don't even know that they have resources available to them, and they don't know that they can reach out. And so I'm so glad, you know, that we're talking about that and shining a light on the fact that there are resources, there is help. And even if you reach out to somebody who doesn't have the help themselves, help is available.
And thank you. That I think is so true. And I think that's something that's very understated and really something that we really should be keeping top of mind. And think just in general for everyone, there are resources available out there for you. You just need to take initiative and take the first step and find them. And unfortunately, our time is almost up, which I'm very sad to admit, because I think we've been having such a great conversation, but I know this is just the start of the dialogue. There's a lot more to be said. So I hope to continue this conversation in the future, of course. But again, as we wrap up, I'd like to give each of you a chance to share some last piece of advice, some last insight or recommendation, or any last words that you would like to share with our viewers here on Zoom and also our viewers on Facebook. So I'd like to start first with Dr. Jacob.
I guess just to summarize, I think we as a society are going through a very hard time. It's important to recognize this is a very hard time, and with the collective help available, we can get through it. It is challenging, but it isn't impossible. There's lights coming in our direction, so it's a long battle, but I think it's nice to see how resilient we have become, and as long as we shed light on what can still be done, I think I'm very optimistic.
I think it's important to stay optimistic, especially now when things right now things are looking to be on the rise, on the horizon, good things. So I hope that that is true and that continues going forward. Dr. Butts, would you like to say some last words?
Yes, I really enjoyed this. It's so enjoyable to meet new people and to meet amazing, friends. Like how now everybody's a friend, but colleagues, peers. So I hope that this is just the beginning of more conversations and more ability for us to be able to bring very much needed resources to those who wish to avail themselves of them, and just that, so that we can help people not just get some help for a day or a week, but long lasting sustained assistance well after COVID is over. And so that's my hope. And I'm glad that this is the first of hopefully many of those kinds of discussions.
Yes, I completely agree. And of course, again, thank you so much for being here. Dr. Sangan, what are your last thoughts, your last words?
So this pandemic it's affecting all of us in many, many different ways, shapes, and forms. We all have a shared experience though of going through this pandemic. The important thing to recognize if and when you need help, and also if someone else tells you, listen, you need to go talk to someone, you need to go do something, just take that in mind, because sometimes you may not be able to recognize symptoms in yourself, but you can see things in other people. And the best thing to do is take life one step at a time. So literally just walk one step at a time. And that's the best thing you can do for yourself, is just advocate for yourself and for other people as well.
Thank you so much. And I'd like to share the message that we have in the chat, which I completely agree with, that Francesca says that she did mention this in the last panel last week, and I remember, but it's okay not to be okay. It's okay to ask for help. You're not weak when you ask for help. In fact, doing so brings you one step closer to gaining control of your own mental health. And I think that is a beautiful point that I think is very fitting to end with. I'd like to thank all of our wonderful panelists for taking the time on this evening to share with us their insights and their thoughts and their wonderful ideas. So again, thank you, Dr. Jacob. Thank you, Dr. Sangan. Thank you, Dr. Butts. I really appreciate all of you being here. We will definitely make sure to share all of the resources you shared, both in the comment section or the description of this video on Facebook and also on our social medias. We also will definitely continue this conversation, hopefully sometime soon. Again, I know that this is just the first part. It's just the first step, and I appreciate all of you joining us on this first step. And I'd like to thank everyone who is joining us on Zoom, as well as everyone who's joining us on Facebook. And I hope you all have a great evening and a happy holiday season. And remember, you are not alone.